Hello, everyone, and welcome to the Heartfulness Wellness webinar series. Today, we're going to discuss an important global topic that has affected each one of us in many ways, and that is COVID-19. And this webinar is unique in the sense that we have three special people with us, three eminent physicians who are in the front line dealing with the situation of COVID-19, and they are here to share with us their experiences and first-hand information. The first one that I would like to introduce is Dr. Raja Amarnath. Dr. Raja Amarnath is from Pulmonary and Critical Care Specialty. He is a professor and head of the department. He is the Director of Critical Care Services, Sri Balaji Medical College and Hospitals, Chennai. He is a Senior Consultant at Apollo Hospitals, Chennai, Managing Director, CIPACA, that is Chennai Interventional Pulmonology and Critical Care Associates. And he is also the director of CIPACA Institute of Research. And he also is a stress management course coordinator and clinical guide at ORMET, that is Omega Rural Medical Educational Trust. And the next speaker that I would like to introduce is Dr. Sudhir Rajan. He is certified in internal medicine and pulmonary and critical care. And he is a Permanente medical group physician based at Kaiser Permanente Santa Clara Medical Center. He also serves as associate program director for the internal medicine residency. He is currently a clinical assistant professor and clerkship site director for the Stanford University School of Medicine and an assistant professor of clinical science at the new Kaiser Permanente Bernard J. Tyson School of Medicine. And the third physician that I would like to introduce is Dr. Radheshyam Miryala. He is an emergency medicine physician, and Dr. Rad is the founder of I Heart Nature, a very popular natural skincare wellness brand. He works as an emergency medicine physician in Deer Park at Community Health First ER. He is an avid speaker and has given talks to churches, corporations, and community organizations on wellness, meditation, holistic approach, happiness. He is a meditation trainer and an expert natural wellness enthusiast who enjoys spreading the benefits of living a balanced lifestyle through meditation. Welcome, dear colleagues and physicians. It's very nice to have you here. And it's very unique that we have you here who have a first-hand experience and exposure to what is kind of troublesome for the entire world. The world is going through very uncertain periods. This pandemic has affected almost everyone in some way or the other. So welcome, and we look forward to hearing words of wisdom and your experience that you're going to share with all of us. So the first question I would like to ask each one of you, what's your personal experience of dealing with the COVID-19 situation? Maybe Dr. Raja, would you like to start sharing?
Yes, brother. When we were all asked to cover the COVID patients, exactly, let us say 1.5 months ago in Chennai, initially we were really apprehensive. Is my voice audible?
Yes, we can hear you.
Good, good. So then what happened, the hospital where I was working previously, a branch of Apollo Hospitals has been made into COVID unit. They shut down all other services, including all cardiology, interventional cardiology, neurosurgery, ortho, everything they have shut down and made entire hospital of 300 bedded facility into COVID hospital. Then what happened? They made all of us, some physicians and pulmonologists together. They made us as a COVID team. So I, being the pulmonology and critical care background person, I got involved in the team. Of course, we are so consultants, so every day one person would go, stay there for 6 to 8 hours in that PPE suits, and then take all the rounds. Maximum amount of work we are doing from outside, counseling the relatives and giving orders, everything will happen outside. Only the clinical examination will happen inside, so minimizing the exposure. It was, to begin with, extremely stressful and apprehensive for the first few times. Once you are inside the sanctum sanctorum, then you see people are not that bad, that sick. I don't know about your area. In India, God's grace, it is all the more behaving like any other general flu. So far as our ventilator patients are not even 1% of total population, and we are extubating many people, except extremely morbidly, moribund people with too many comorbids, previously sick people. All other people are coming out. So for me, it must be taken as a lesson rather than a bad news. So that's what I feel. Combining both the spiritual aspect and the the medical aspect together, if you ask me, this would be my single word answer.
Wonderful. Thank you for sharing, Dr. Raja. Yeah. And let us hear from the Western perspective, see what's going on in here. Dr. Sudhir, would you like to share some of your experiences with us?
Yes, thank you. So I can confirm a lot of the things Dr. Raja says. I think that's kind of universal in the feeling that you have. We live in an area, or I live in an area on the West Coast that was one of the initial hotspots in America. So we did the exact same thing. We shut down all elective cases, surgeries, and we made multiple COVID teams, of which I was obviously a part of. We did get a large influx of patients initially, and we found that oftentimes they would get very, very sick. And the difference that we saw, at least, a long time to get better. So normally where an individual might stay in the ICU for 5 days or 7 days, many of our patients were there for 3 to 4 weeks before we were able to successfully get them out of the ICU. What we found, though, is compared to other places in the United States, because we prepared and had active teams and active protocols, our outcomes, or the outcomes of my patients and my colleagues' patients, was far superior to a lot of areas that were overrun, like Italy and New York and places like that.
Thank you. And Dr. Radheshyam, would you like to share?
Hey, thank you. That was wonderful to hear, Sudhir. So in Texas, it's not been that bad. Since March, I mean, we've been expecting a deluge of patients, and, we've been hearing every 2 weeks, it's going to get worse, it's going to get worse. It really hasn't come to that. So perhaps the social distancing worked and the curve got flattened. I used to be an assistant professor at UTMB that has like the Galveston National Lab. So it has a big virology center. And so I've been talking to them, even the mathematical modeling that they've been doing, they've been expecting a deluge of patients. It's hasn't really panned out here in Texas. We have had some cases, I know of people who've had, sick family members have been in the ICU for 20 days, 25 days. But, and even in our facility, we've had some patients, but the city has not been overrun with COVID patients. Truthfully, what's happened is, we've shut down all elective procedures, and, they're expecting a deluge of the COVID-19 cases. It's never happened. So, hospitals shut down 2-3 floors and had to furlough their staff or cut hours and stuff like that. So we saw a different situation. Texas opened up recently, so people are going about and doing, interacting, and you start seeing less and less of the people following the social distancing and the mask rules. So we don't know what's going to happen. So maybe in the next 2 weeks we'll see something different. But we're most of the work related to COVID has just been the planning and the preparation, making sure we have enough PPE, getting enough masks, getting enough gowns, and just setting up the protocols at our facility, make sure we disinfect, that we see that, we have a protocol for intake of patients and discharge of patients and cleaning the facility as patients come through. So that's been most of the work is, kind of revolved around that. I'm still waiting to see like the deluge yet.
Thank you. Thank you. Right.
Well, I would like to add also one thing that Dr. Raja brought up that I forgot to mention is he mentioned having the apprehension in the beginning. And I think that is something a lot of providers have. Because we were very early on, we didn't know exactly what PPE to wear. Sometimes we would wear everything because we were nervous, and you actually had to stop and take a minute to reflect before you went into each and every patient's room. And when things got busy, there were a couple times when even myself, I had walked into a patient's room without proper PPE and had to stop for a second, whether it's forgetting to put on gloves or forgetting to put on the face shield or something. And I think that taking that time to stop and reflect in the very beginning was really helpful, rather than rushing in fully on adrenaline and charging into every room and trying to take care of every emergency.
That's a very good point that you did, Dr. Sudhir. Thank you. And while we are talking about that, I know Dr. Raja mentioned that in India, the cases have been very similar to the flu-like cases. What has been your experience, Dr. Sudhir? How is it different from flu, or could you say a few things about it?
Yeah, for us, it's been different than the flu, and I think a lot of physicians will understand when I talk about ARDS or acute lung injury. When these patients were getting sick and they were going into the ICU on ventilators, we found that there was two subsets of patients. There were the patients that acted like the traditional flu who got better quickly, but there was this cohort of patients that unfortunately their lungs were not very compliant or very easy to ventilate or oxygenate. We found those patients required significant therapies in order to maintain proper homeostasis, because these individuals, in terms of how sick they got, they accelerated pretty quickly, and it would often go for a week, or 10 days, or 2 weeks before you would see any improvement. And it might have required things like proning, paralysis, inhaled nitric oxide. We even had to put a couple patients on ECMO, where you're oxygenating the body, the blood outside the body. And we saw both patients 50 and older, 60 and older, but we also had several patients that were very young, and that was very surprising. The good news is all of our young patients fully recovered and left, which is amazing. And I think that it also shows that a lot of these things that we can do when someone is sick and young can have potentially very good outcomes.
Thank you. And Dr. Rad, this is a question for you. Many countries are going through this uncertain times because of this pandemic. And in some of the countries, we've seen that they've reached a peak and things are settling down. And in others, the cases are trending up. In situations where the cases are trending up, what do you think would be required to slow it down, maybe at an individual level? Would you be able to share some of your thoughts?
Sure. I think, Atul Gawande wrote a great article in the New Yorker, which I don't know if you can put show notes to that link. I can send you the link for that. But, he was talking about, things that we could do, hygiene. So for hygiene, washing your hands and washing your hands frequently, like every few hours. And then disinfecting your environment, disinfecting your home and your workplace. So those are two things. Social distancing is another thing. Screening, so like at work, screening employees, self-screening, self-quarantining, that's another measure. And then of course, masks. If everyone wore a mask, I mean, the literature shows that it would decrease the spread. At an individual level, I mean, I think we all have to think about ways that we can help boost our immunity. And in one way, you can do that, some natural ways to do that, ensuring that you get a good night's rest. So having good sleep cycle, getting a good 8 hours of rest every night has been scientifically proven to help boost your immunity. Maintaining peace, being peaceful, not being in a stressed out state where you're releasing a lot of cortisol, but, having equanimity and peace, that's another way to help boost your immunity. So since we're all in the Heartfulness movement, I mean, I would say that for me, meditation and having a regular practice of meditation has helped me, maintain a good sleep hygiene and maintain some peace. And I feel like everyone should, that's one thing that everyone can try to do outside of wearing a mask and washing their hands.
Excellent. Dr. Raja, what have you been doing in India? I know the cases are going up a little. What do you think would be important to do in this situation?
See, this is something which has been expected, right? So in India, slowly they are lifting the lockdown restrictions, and except for certain areas like, for example, like malls, weddings, so where there are mass gatherings, temples. So other things they have released already. For a few days, the cases have, the reports are increasing. Also, the availability of tests have been increased. So that is also another reason why the numbers are increasing. As I told you before, so for 100 cases, only 5 or 6 are getting admitted, out of which only 1 would be really sick who requires support. So number 1, people are now used to the news that numbers will increase because of the lockdown restrictions are going out. And people are also now are settling down that, the diagnosis is not a bad news. Only few people will get affected. In one way, it is good also to mingle and let the cases rise, because herd immunity will develop. Otherwise, once you lock down everybody and open up, the same thing would happen what would have happened 3 months ago, no? Before the lockdown. Suddenly you have surge of all the cases coming out. So a slow release of lockdown restrictions, allowing younger generations or healthy people to, get, I don't say get infected, but at least develop immunity, get mingle and then develop immunity. In the same way, protecting the people with pre-existing cardiopulmonary or other comorbids, especially elderly people from it, until you get treatment, should be a right choice, and that is being followed at least as far as India is concerned as of now. So that's it. The same level of panic is not there. 2 months ago, people were diagnosis means people were actually thinking it's a death sentence. I don't know how many of you remember, even doctors were not allowed to go back into the apartment. Whoever is working, of course, fortunately I have my own house, but the doctors, the residents who are working in COVID unit, if they want to go back to their apartment, people were not allowing them. They threw them out in some places. That was the situation 1 month ago. Now people are slowly, understanding it and adjusting to it. Did I answer your question? Is this what you asked?
I also like the way you mentioned about herd immunity, but not in a very graded fashion, not exposing everyone at the same time, opening up in a cautious way and slowly build up to where we should be. I really like that.
So I'm curious, why do you feel like in India the mortality or severity isn't as seen in New York or Italy or other places? I mean, like I was assuming that a lot of this was due to population density. So in India, with cities that have some of the highest population densities, you would have more severe illnesses.
That's a.
Do you feel like a different strain or?
That's $1 billion question. If you answer that, okay, you wouldn't be here. So everybody is breaking their heads to answer that question. I tell you what the local thinking is. People here are completely convinced and they are happy, comfortable. Even when I am asked to give interview, I am saying the same thing, that traditional living is what we are actually linking it to. The Indians are, of course, you are all Indians, although you are settled there. See, for us, in India, you tend to get more number of viral infections compared to the Western world. In any rainy season, winter and rainy season, usually every Indian would get at least once he would get flu. So this is the hypothesis which we were actually proposing to everybody, that it is very lucky that this problem COVID has come at the end of December, which means January or February. So in India, COVID has stepped inside only in the month of March significantly, which means people from last year June, July to December, everybody would have got infected by some viral infection and healed, and that their immunity is under active mode. That is one reason. The other reason is, as I said before, people are more nearer to nature. Okay, here the mineral water usage is comparatively less. Whenever we go out, we all drink from the roadside shops, but that puts us into several times of some infections, whatever it is, but minor levels of infection where you could get out of it. So this is one reason we are proposing. Second thing, local people are saying we use more of herbs, and more of what should I say? We use less number of allopathic medicines. Although we are all allopathic people, here the governments are endorsing naturopathy and Ayurvedic products here. Kerala has been praised extravagantly for controlling the disease, almost compared to any other state. In Kerala, they have controlled the disease very well. That's what the statistics say. And the health minister has been praised of using naturopathy and Ayurvedam combinations for that. So it has been made a rule in Tamil Nadu also that there is one sort of concoction available made of local herbs that is being given to all the patients. in corporate hospitals also, and patients are all demanding for it. Give me that medicine, because there is no other valid medicine available in allopathy. So even see, I am prescribing the same thing apart from water gargling and other things. So there is no clear-cut reason for that. These are all the possible hypotheses are going around.
So like in America and other places, it was the elderly that had the highest mortality. Like in Texas, 76% of the mortality cases were in patients over 65, and of that, the majority of the the deaths came from patients that were over 80. So is there a cultural difference in India for where they may not take an elderly into an ICU setting or a hospital setting if they're ill? Or
it's not like that. See, all the deaths that we have seen here in COVID are also in people more than 55, 60 years of age. Youngsters, I have seen I think 3 or 4 people of less than 30 years old going on to ventilator, but they have, both of them are extremely obese. They weigh more than 120 kilograms, and we could wean them off by I think second week. It did progress to a brief ARDS, and then there was a rapid response back, and then we could wean them off. But elderly people, see, this is what my personal experience. I don't know whether we need to do a multi-center trial to prove it. I hope your experience also, at least to some extent, should correlate with what my experience is. It is a flu, like any other flu. Some people, it is going up to the respiratory system where it affects lungs. 90% of the times, everybody had ground glass opacities in the lungs and without hypoxemia. Some people, it is going up to the pneumonia level or ARDS level where they require support. And the immunity comes back, and the basic problem is healing up. But then what happens is, by that time, elderly people and people with multiple comorbids are landing up in secondary complications. That is what is the main reason of mortality, at least here in India. Maybe a minority, very less percentage of people are progressing to directly viral related complications. Very minor percentage of people. This is what my personal experience. You can say it's an anecdotal experience, but we need to check on it.
That is a valuable experience to share. Thank you for that. Thank you. And Dr. Sudhir, in your experience, what treatments have shown success from the cases that you have dealt with?
Yeah, I think, again, Dr. Raja's points are correct. We saw the same thing with the patients that did pass away are usually due to other complications and are elderly. I think one of the things that we saw early on when there was a large amount of patients in the beginning is we were very well prepared, and in many hospitals up in California, because of the early stay-at-home policy, as well as that prevented an influx of patients, and many other hospitals had teams ready to go. I think one of the things that we saw in other places is they were not prepared. And a lot of these mortality numbers that we see that are very high, maybe, and again, this has to be looked at in more detail, but maybe that is a lot due to the fact that they just did not have enough people to take care of patients that were very ill. And so I read many blogs and many stories that were written about physicians and nurses who simply just went from patient to patient in order to treat whatever the active problem was for the day, but there was no focus on getting the patient better because there was no time for that. And I think when systems are ready or in place, then they can actually do things. And to answer your question, things that you can do when you have resources include providing patients with other forms of ventilation short of a ventilator, whether that's a high flow oxygen or a BiPAP or a CPAP. We used a lot of awake proning, having the patient lay on their stomach in order to prevent intubation. Proning after intubation, early paralysis. We used INO to help with oxygenation, early nutrition, and are some of the things that we use that we found to be very successful. In terms of medications, unfortunately, because there is no medication, for example, I know this will come up later, but the hydrochloroquine azithromycin, I was using that early on, but then we stopped using it because we didn't see any improvement in any patients for the most part. And then Kaletra, the HIV drug, was used many times, and again, we didn't see any benefit to that. The flu drug or the viral drug remdesivir was given actually humanitarian-wise a couple times early, and anecdotally we saw improvement, and it looks like a study just came out in New England Journal showing shorter hospitalizations. Again, we don't know if that affects other things. And otherwise, there was no real drug or medication. We did give vitamins. We gave vitamin C, vitamin D, multivitamins. Steroids were used, but again, oftentimes we reserved that for when the patient was so sick and we felt like there was nothing further that we can do because the early data had suggested steroids would worsen outcomes. So in the beginning, it was kind of there was a lot of different therapies that people were on. And as time went on, a lot of these therapies were disproven or proven to be potentially harmful, like hydrochloroquine. And now I think a lot of it is gone mostly to supportive care.
That brings us to this question of hydroxychloroquine prophylaxis, right? I know there was a recent paper in Lancet that talks about it, which shows not much data for hydroxychloroquine prophylaxis. Rad, do you want to share something?
So I mean, this is a question that I get often, that I get asked often, is whether I could prescribe hydroxychloroquine prophylaxis to patients, and I always go back to the basic principles of do no harm. So I mean, should we prescribe this medication that has lots of complications that could send people into tachyarrhythmias? So I have not. The literature doesn't support it, and so that's not a practice that we've been doing. And both, it's both hydroxychloroquine and azithromycin. Both of them can prolong QT. Azithromycin less so than hydroxychloroquine. So I don't think it's the right thing to do, just to give it prophylactically.
And while you're on, in terms of testing process, when is a negative test a true negative? You want to share some of your thoughts on that, Rad?
Yeah. So there's two types of testing right now. There's the PCR test, which if you've seen the images where they take the swab and shove it deep down into your nose and all the way, and looks like it's about to touch your brain. It's very uncomfortable. Patients hate having that test done. So that's the PCR test, which looks for the viral RNA particles. So it takes about 2 to 5 days to get that result. The other test that we have is a bedside point of care test, which is the immunology test, and that tests for IgM and IgG. We've tried different vendors. We've not seen a lot of consistency. The one that we have currently at our facility is an FDA approved EU8. It's the ChemBio one. It's supposed to have sensitivities in the high 95 sensitivities and specificities, but we've tested it with other tests and in multiple patients. We haven't really gotten consistent results. I don't know what Dr. Raja or Dr. Sudhir's experiences have been with this. So I try to take all of it together, take the PCR and the IgG, IgM results together, and of course look at the clinical picture to make a decision. We've also been using chest X-ray or CT scan to help us make a diagnosis. In where I'm at, whenever you look at the test characteristics, you have to look at the prevalence in the population. So the prevalence of the disease has been pretty low in the population. So we it's possible to get a lot of false positives, right? So.
Any thoughts, Dr. Sudhir or Dr. Raja?
I would say one of the concerns is obviously the false negative. And in patients who we have a high suspicion, we're testing them or multiple times. Some initially, when this all started, sometimes it was 3 or 4 times because there was such a fear of accidentally letting a patient through. But I think, most tests hover around a sensitivity of about 70%. But because that's not close to 100, I think oftentimes the test will be repeated. And these are the nasal swabs. And even then, if a patient is still very high risk in terms of suspicious symptoms, oftentimes most hospitals have been keeping them in the proper isolation just to protect the healthcare workers.
Dr. Rajan?
We have a predefined protocol. Even the government also is in same line with this. We look at a pre-test probability. So we have a set of questions, and then if the patient has acute URI symptoms, plus there is an exposure to COVID positive patient or coming from a red zone. Red zone is where the COVID impact is more, density is more. Then only we test. Otherwise, if somebody comes and asks for test, we don't test at all. There is no point in creating a panic. We only advise them for a self-quarantine for 14 days. Now, a patient comes with symptoms and you do a test and the test is negative. Then we are doing CT. We check the CT scoring of the ground glass opacities, and if the score is more than 25%, which is around more than 6 points on radiological scaling, he comes under high degree of suspicion. We first quarantine the patient and then we repeat the test after 48 hours. And then if that is negative, we check for the other reasons of that ground glass opacities. If it is positive, he becomes a COVID positive patient. So both the PCR as well as Ig antibody tests have false negative possibilities, because that is the reason why 2 tests are required before declaring a patient negative also. Once the patient gets treated and you do a test, it is negative, we are repeating the test after 48 hours to see that there is another negative. Only then we are releasing the patient, discharging the patient. Similarly, to take inside, if the first test is negative, again we correlate this with the radiological features and then repeat the test if required. Ig immunoglobulin tests kits are not currently allowed in India. Initially, they have imported certain kits, some kits from China, but ICMR said, Indian Council of Medical Research, ICMR said that there is high probability of false negatives through those tests. So then they were not allowed to be used.
Okay.
Some good points shared there. Thank you, Dr. Raja.
Welcome.
Thank you for that's an interesting protocol. Thank you. I appreciated hearing.
Thank you.
And when we are talking to you, Dr. Raja, for general public, right? When would you suggest that they should seek medical attention if there is a concern for COVID? Coming back to from a practical point of view, what is the advice that you would give to general public?
To our public here, we only tell them if there is a breathing difficulty or if there is a high degree of fever where you cannot control with home-based paracetamol and other things, then only they seek medical attention. We clearly, even at the level of government level, they are clearly indicating to entire public not to rush to hospitals and block the services for the much more needed people. Even when I get calls from my patients, we tell the same. If you are asymptomatic, your apprehension is only that, the most common thing is that somebody in that vicinity, in that street, somebody becomes COVID positive, and 4 days ago you would have had a 5-minute conversation with him. That's enough. So immediately they call the doctor and say, I suspect that I got COVID and I need care. That is one thing we should avoid, no? Because when they come and they block the beds, for the much needed people, tomorrow you will not have medical facilities. So we discourage those people. We say, if you get symptoms, only then we will check. Until then, okay, fine. You follow your social distancing. If you want, you can quarantine yourself. No problem. Second set of people are the people where one family member becomes positive. We had at midnight, 2 o'clock, coming to casualty, suddenly they call me saying 8 people of the same family came for admission, which means where only one person got COVID positive. Rest everybody came saying we need one room. In a regular scenario for corporate hospitals, this is a boon. Where will you ever get in India 10 people coming and saying I want to get admitted? They never come, no, normally. But here we had to discourage them. He said, no, only that person who had symptoms will be inside. All of you go back and get yourselves home quarantined. And the third set of people are the people who develop symptoms. They say, from last night I have been having some itching in my throat. That's it. They say it could be COVID. Then again you have to counsel them. The fourth set of people are the real people where they have high degree of fever. But even that, what we are advising is only salt water gargling, and there is one herbal concoction available. We tell that, and then tell them to take paracetamol, rest, adequate hydration at home. Even after that, someone gets features of breathing difficulty, then they come to emergency. Then whatever the set protocol I told you, check the COVID, negative, check the CT, then correlate both and then get them admitted. This is what from the community level until the hospital admission, now at least more or less the protocol is set in India.
That actually answers my next question as well. Thank you.
Good.
No.
So, are you able to share the herbal concoction? I'm curious to know what
I will
is.
see. I am basically from Andhra. This is Tamil Nadu, where I am talking from is Chennai. I will check and get back to you on that. It is called Kapasara Kudineer in Tamil. It will be extremely bitter. You can't even take a sip of it. But people are happily drinking it for the fear of COVID. 2-3 times a day they give small, like what do you call that? Quarter, you call, no? That much of amount of this thing is being given to them. They're happily drinking, and everything, all the success is attributed to that. Not to doctors, not to medical care. That's what is happening here.
That's excellent. Thank you.
I will get it for you. Let me check with these people and get it for you.
As physicians who are treating patients with COVID, being in the front line, right? What is it that is driving your work? Is it a sense of duty, or is it a sense of fulfillment of doing good, or is there anything else that you'd like to share? Rad, do you want to start?
Sure. I mean, this is the job that I've wanted to do for a long time. This is, you know, the job I signed up for. This is our duty. If you want to use Indian words, it's our karma, it's our dharma to do this. I mean, I love being a doctor. I love going to work. I love seeing patients, and you know, in this profession, you know, it's always changing, and you know, things like this happen all the time. When I started training, HIV was a big deal. So, you know, when I was in residency, every hospital in America had a HIV/AIDS floor. So, you know, we've solved that problem for the most part over the, you know, and then back then trauma was a big deal. Like, you know, car accidents, if somebody was in a car accident, you know, they would get severely injured. But car safety technology has improved so much in the last 2 decades that, you know, people can be in a 50-mile-an-hour, you know, auto injury and not have significant injuries, automobile accident, and not have significant injuries. So again, you know, this is another challenge that I'm sure we'll all rise up to and figure out a solution. And so it's you know, it's something that that I feel fortunate to be able to participate in this journey.
Any thoughts, Dr. Sudhir?
Nothing so thought-provoking, just very similar to what Rad has mentioned about the desire to help. And you know, oftentimes in your work days are they're different, but they're not very different. And this is kind of a challenge for frontline workers, in order to have to think outside the box, think quickly, make decisions when there aren't many treatments, and education being a really, really big and important thing for all of our patients. But it's something that, you know, we haven't seen in our lifetime like this, affecting everyone. And we may see it again in the future in something different, but I think that most of us went into these fields for a reason, in order to help people. And I think it's good to be supported by our family and friends and others when we're facing this battle.
Thank you, Dr. Sudhir. Dr. Raja?
Yeah, I totally agree with both of them. So being both emergency department and, you know, in India, pulmonology is during post-graduation days, it is nothing but tuberculosis and HIV. So we have seen such things. Okay, so in TB wards, when you are working inside the tuberculosis ward with multi-drug resistant tuberculosis, plus or minus HIV, we all have worked, you know, in those areas. But to be honest, when our hospital said, doctors, you are the team of people you are supposed to manage COVID, those days means almost 2 months, 45 days ago. Do you know there were 2 doctors died exactly 1 week ago by then? One was a senior neurosurgeon, the other was an orthopedician, and it became a big news in India. They were, none of them were managing COVID patients, but both of them contracted it when they were managing regular patients. Some of them might have been carriers. One patient would have infected them. They were on ventilator, and ECMO was offered, and finally both of them died in a span of one week. And that was the time we were asked to go inside and manage the COVID unit. For me, to be honest, at one point of time, a thought did pass through my mind that I was in some unfortunate situation. But what saved me was that, this meditation practice. I said, okay, fine. If this is the wish of the master, let it happen. Supposing if I have to die from it, let it happen. Then, whenever I go for rounds, I think, I am being, covered by master. The grace is covering me like that. Although I was wearing PPE, I would give that thought and then go inside, which gives me some sort of comfort. 2 days I did like that. After that, it became easy because when you go for rounds, everybody was half the patients were stable, just cough, cold. Only few people were really sick. So then that gave me sort of a good comfort. After that, it became now I am actually enjoying being in working in COVID unit because so many people are asking questions. How do you feel? People are giving us great respect, and we suddenly became local heroes, local celebrities. I am enjoying it now. That's my emotional story.
Thank you for sharing, Dr. Rajesh.
So, I mean, I'd also want to clarify, that we can't also be cavalier about it too, that we still, like, there's a lot of young residents, young doctors that are very nervous. There are situations where people are asking to work and they don't have the proper PPE equipment. They don't have enough N95 masks. They don't have enough gowns. So although all three of us, expressed a very emotional, gratifying, joy for practicing medicine, I also don't want the message that, we should be cavalier about it. I mean, we have to take the precautions. Your first duty is to protect yourself, in this situation.
Correct.
So.
I agree. I think you said a very good point, Rad. Often healthcare professionals are being portrayed as superhumans, right? But we know that we are as human as anyone else with our own fears and anxieties, right? So it's good to acknowledge that we all go through these fears and anxieties, and I think Dr. Raja clearly said it that when this started, he went through this period of anxiety, a period of fear. So it is normal, and we are not superhuman. We are as human as anyone else, anyone can imagine. One question. So Dr. Sudhir, if someone gets diagnosed with COVID, right? What would be your recommendation? What would be your suggestion? Say someone goes for a screening test and they get diagnosed with COVID. What would be the advice that you would give for these patients?
I think this is where Dr. Raja eloquently put his subset of patients. And I think that those 4 subsets that he used are the same subsets that we use here. We are not testing everyone, at least in Northern California, just because there just isn't enough tests. But if someone is having mild symptoms, we tell them to quarantine at home. Those individuals who have any sort of symptoms can get tests, but it's more just for them to know and to monitor their temperatures and to monitor for pulmonary symptoms. Individuals who actually do have symptoms and are feeling very short of breath, or like Dr. Raja said, can't control their fever, or another symptom oftentimes is very bad diarrhea, and they're getting dehydrated. Those are the patients that should come and be evaluated by a physician. One of the things that we do and many places have done is having physicians who many physicians can't see patients in the clinic because of exposure risk. So they are doing phone calls and video chats and reaching out to many of these patients that are testing positive or who are concerned and reassuring them. And I think education is very important in this instance.
And as a physician who's treating patients with COVID, are there any precautions that you're taking, Dr. Sudhir?
That's a good question, because I think that many of us don't know or didn't know. And I think proper PPE was always the question. And I think many of us were concerned about whether or not an N95 was appropriate or not. And in the beginning, most of us wore N95s for most of the patients because of the high exposure risk. The other additional things besides the things that Rad mentioned with the hand washing and the social distancing, et cetera, which we try to do at work, but it is difficult, obviously, in a hospital setting. For me, for example, I come to work in a pair of scrubs, and I think Rad's wearing scrubs right now. But if you knew me personally, I never wear scrubs. I'm one of those that wears shirt and pant to work, and I don't even wear the white. The white coat never gets worn by me, but I just wear the shirt and pants. And so to wear scrubs was very different for me every single day. In addition, many of us are wearing disposable OR jackets over the scrubs, as well as a mask and eye protection as we're walking around, because there may be asymptomatic carriers working with us. At the end of the shift, we're disposing of our entire clothes before we come home, throwing away the paper gown, changing to a brand new pair of scrubs to come home. And even though I'm wearing clothes that I've only worn just to the parking lot, I take a full shower and everything and leave my shoes and everything, which have already been wiped down. All that doesn't come into the house. And these are not even clothes that I wore to see the COVID patients. But this is kind of the new normal that many of us have been following because of the fear of exposing our family or contaminating our environment.
I think you shared a very important point, which I'm sure most of those who are working in healthcare setups have been telling me what they're doing. Rad and Dr. Rajan, any comments or anything that you would like to share? Rad, do you want to start?
I mean, I think Dr. Sudhir, said it best. So, like, I know of it, some physician families where the doctor's getting quarantined, which Dr. Raja kind of alluded to earlier. So where they're staying in separate apartments or whatnot, and not coming in contact with their family. The prevalence of the disease hasn't been that bad in Houston, so we haven't been following such strict measures. But yeah, I mean, I follow similar protocols to what Dr. Sudhir was doing.
Anything special that you're advising your family members? Either Dr. Sudhir or Rad?
Yeah, I think that was a discussion we had because there was a big I live in Santa Clara. Well, I work in Santa Clara County, but that was one of the major hotspots, and we had a big discussion. We decided as a family not to see parents on either side. But I have 3 children, and now they were at home because school was being done from home. So I think discussing with my wife and having a feeling that if I sequestered myself away, it may cause more strain and harm on the family in that aspect. So we chose to stay together and do it this way. I think for many of my colleagues, they did sequester. Now that the numbers are very low or are minimal, Obviously, most of my colleagues have gone back home, but I think that was a discussion that went on with a lot of families.
And Dr. Raja, this is a question for you. This pandemic has triggered some psychological stresses, anxieties, and suicides. There are also increased instances of domestic violence. I know you mentioned about practice of meditation, and I know, Rad, you also mentioned the practice of meditation. Would you be able to share with us about the practice and how you feel it's helping you, whether it is a component that boosts immunity or a general well-being, Dr. Raja?
Yes, it's a good question. Even we have been advocating to all our patients also. You see, if you look at the overall picture of COVID, you are facing a virus, although it is another flu kind of virus, but its attack rate is very high. The question comes, it might affect people who are already having some comorbids, chronic comorbids, especially when they are not under good control, or elderly people are definitely at a higher risk of ICU admissions or even mortality. And there is no treatment for this virus as of now, no drug, no vaccine. Okay. Apart from social distancing, masks and gloves, is there anything that we can do? So recently it was asked by one person, in a TV interview, and I gave the same answer. None of us, many people, they do not know that anxiety, apprehension, and stress have, apart from creating a disturbed mindset, they have a phenomenal negative effect on body. Like, uncontrolled diabetes, uncontrolled heart rate or blood pressure, all these things, and the hormones, cortisol, higher cortisol levels. And when you go deeper, increased levels of TNF alpha, interleukins. So I connect them with the current situation also, that COVID causes the same scenario, where one of the cytokine storm has been defined as one of the poor prognostic indicators of mortality in COVID. Also, any chronic comorbid condition, maybe uncontrolled BP or chronic cardiopulmonary ailments, when there is a stress, these things go out of control. And you have a system which is out of control already, it is easy for COVID infection to break that system down. And you are now succumbed to all the complications. So when you connect back, ultimately what is one of the very important solutions is to control your anxiety and stress. Not every time brooding over all the social media messages saying that the number of COVID cases are increasing, so my throat is now giving some trouble, so is it COVID? Fine, your thinking is not wrong, but the apprehension and stress are definitely going to affect people. So both in our personal experience as well as scientific medical experience, more importantly evidence-based recommendations are that meditation reduces the negative influences of immunity. Stress is a very important negative influencer of immunity, and meditation boosts immunity. COVID requires immunity. Simple. So A is equal to B, B is equal to C. So if you can control your stress and anxiety here, your immunity will get boosted up or get strengthened. Not only the herbal things are vitamins, of course they are also important for keeping the immunity strong, but the psychological aspects that can weaken, wreck the immunity are also important, which people should take account into, for which the best economical, simplest solution would be meditation. So many areas I connected meditation directly to COVID prevention and survival. Of course, there should be a study in future, but based on the previous experience, you don't need a direct study to show that meditate and then COVID won't be there. To survive from COVID crisis as of now, meditation from the previous studies, meditation has been shown to improve the outcomes. So for us personally also, apart from all these evidence-based things, personally for me, it has given me enough strength to deal with the situation when I'm whether willingly or unwillingly, I was forced to be on the front line of the force. It helped me, definitely yes.
Wonderful. Thank you for sharing such a deep and profound way of connecting your own personal experience with science. Thank you for that. Brad, do you have anything to share?
I just want to clarify, I'm wearing a scrub at home. Prior to the Zoom conference, I was in pajamas, so I wanted to look a little more professional. So I put on a pair of scrubs. But no, I agree with everything Dr. Raja said. I think he said it very eloquently, that, you have to do what you can to help your immunity, and not just through COVID, but, for your life, for your life after COVID. There are a lot of benefits to meditation, and it's not just the immunity, but the decreased level of stress, the increased peace, increased wellness, increased balance, increased equanimity. All these things, help your overall immunity and your overall wellness and your overall health.
That's wonderful. I think you've summarized all the benefits very clearly. Thank you. Thank you so much, Ryan. And are there any sources of information that you would recommend, Dr. Raja, for public who would like to get some information about COVID?
So you want to still give information to public? I don't know about US, but in India, they are already overwhelmed with information. They are teaching us.
Yeah.
One patient asked me before taking HCQs, said, "Have you taken my ECG?" So to that extent, they are already well informed. By the way, we take everyday ECG to check QTC before we give the next dose of HCQs. They are very well informed on medical areas. They know better than us on which masks to be used, which are better, which are not better. All these things people know in India, thanks to Facebook and WhatsApp and other things. Extremely well informed.
I do think there is just a lot of misinformation that is also spread. I mean, there's access to information is great. It's the greatest it's ever been in the history of the world, but also access to misinformation is also very prevalent. So, I mean, I think people have to be very judicious about how they filter what information they consume.
In India, we have government has released an app. So that is one of the authentic sources of information. That app contains updates. Arogya Setu is the name of the app. It contains all the updates. All COVID positive patients are supposed to install the app that tracks their movements also. And second thing, people are following that. Other than that, I don't think so. You can recommend scientific things to public. No, of course, we follow the guidelines from valid societies, recognized societies. In India, most of the national level health authorities, they have released guidelines on COVID, starting from usage of PPE and masks until the treatment. We ourselves have released some guidelines. Every month we are coming out with the current updates on COVID only for ICU, because we are basically ICU people. We are releasing that. But for public, if you ask me, currently we are recommending our government app which contains a valid statistics. Other than that, we follow the guidelines given by the organizations. That's it.
It's wonderful. As an internal medicine physician, this is very educational for me. Thank you.
Welcome.
And I think this concludes our program. This has been a wonderful session. Thank you all so much. Thank you, Rad. Thank you, Dr. Sudhir, and thank you, Raja.
Thank you. Thank you,
Hey,
Jairam.
thank
for
you,
taking
everyone.
this.
It's
Thank you.
wonderful to spend the time with you. Thank you, guys. Thank you,
Thank you,
doctors.
guys. Thank you. Thank you.
And for those who are interested, as Dr. Raja and Dr. Radheshyam mentioned, stress is one of the factors that we're all dealing with. And if you are interested and if you would like to explore the practices of meditation, one of the free meditation sites that we recommend is heartfulness.org. There are many interesting guided sessions that you can try. There are master classes that you can explore. There is Heartfulness magazine that you can all explore and see how it feels. And at the end of the day, it is only the practical experience that can tell us whether something is helpful or not. But based on the recommendations, I'm sure you have all enjoyed this session. And thank you all once again for joining us. Have a wonderful time. Thank you.
Thank you. Thank you.
Thank you. Good evening, guys.